As the COVID-19 pandemic continues, persons are advised to take the necessary precautions to protect themselves and families. These include wearing your face masks every time you leave your homes, practicing social distancing, and sanitizing or washing your hands frequently. Welcome to Info Hub for Friday, August 21. Thank you for joining us. As we continue to highlight the work of the PPPC government, which has been proactive over the past few weeks, meeting with residents and providing resolutions to issues. In this first report, we tell you that the People's Progressive Party civic government will be moving ahead with legislation in the 12th Parliament, which will see Guyanese benefiting holistically from the oil and gas sector.
Honoring a promise outlined in its manifesto and a subject championed on the 2020 campaign trail, the new government said every Guyanese must share in the prosperity of the oil and gas sector. Vice President of the Cooperative Republic of Guyana, the Honorable Dr. Bart Jagdeo, said Thursday that the PPPC government will be drafting a legislation that will bring local content to the fore. The passage of such legislation will force oil companies to ensure that the issues most pressing to the business community and ordinary people are frontally addressed.
We are moving swiftly. We're hoping before the end of the year that we have draft legislation that we can put before the Parliament to deal with local content and driving more business and jobs for our people. The whole philosophy is that we want the oil companies to prosper, but Guyanese have to share that prosperity. If we don't, then we might as well shut down the sector. If we don't share the prosperity. And we're going to ensure that that happens, that Guyanese share prosperity. This is a promise we made to people, and we will observe it faithfully.
The Vice President said the government has already made it clear during an engagement with ExxonMobil that local content is not just for that company alone.
We believe that enough has not been done to allow Guyanese to benefit from the developments taking place. And therefore, that will be one of the areas that we plan to negotiate with the company very soon. But more, it's not just in negotiation. We're a consultation with the public. We plan to set up a working group. That's why we reached out to Dr. Paul, because we know he did some seminal work in this regard. And then once we've come up with positions that will ensure that our people are treated in an equal manner. If you're a subcontractor, say a Trinidadian subcontractor now, and for ExxonMobil, you get duty-free concessions on everything, tax concessions. If you're Guyanese, and then they can then use the duty-free concessions and they bid on other projects. So they have an advantage over Guyanese who may want to build a warehouse but never got duty-free concession. And therefore, they have to compete with a company that has concession.
With the absence of legislation in this regard, the Vice President said that there are no laws governing local content.
There's been no real definition, and there has been no interest on the part of the previous government to do the audits or to hold the company accountable in terms of definition of local content. That is why people can get away with this sort of thing. So once you have legislation, you have to have put in place the means of enforcing the legislation. And that is why we need a capability in government that will ensure that every provision of the contracts going forward, that those are observed by the companies involved.
For Info Hub, Alexis Rodney.
The Ministry of Health has debunked claims that the kits used to conduct COVID-19 tests are contaminated. In a statement to the media issued today, Minister of Health, Honorable Dr. Frank Anthony, described the allegation as deliberate, irresponsible, and reckless.
The false campaign began after 70 new cases of the novel coronavirus were confirmed on Thursday. The erroneous claim is that the test kits, which arrived from China, were already contaminated, thus rendering only positive COVID-19 results. Minister Anthony stated that, quote, "There are no fake tests in the national system, and no country is sending contaminated tests to Guyana," end of quote. The release also clarified that the batch of test kits currently being used was supplied by PAHO WHO. Additionally, COVID-19 tests are being conducted in Guyana with kits and equipment validated by relevant certifying agencies. The health minister noted, quote, "Besides working with PAHO WHO, Guyana is working closely with other counterparts in other Caribbean countries and with the Caribbean Public Health Agency, which is headquartered in Trinidad. Guyana is working closely also with counterparts in the USA, Canada, Europe, and other parts of the world." End of quote. The health minister assured that there are well-trained medical technologists who play no small role in running these tests. Testing, the minister reiterated, will be expanded as more of these professionals are being trained. The ministry noted that the increase in positive COVID-19 cases at present is largely the consequence of the government's effort to increase testing. This means cases previously undetected because of low testing rates are now being detected. As we are able to detect cases faster, Guyana will be able to ensure we stop the spread of COVID-19 faster. But this depends on all of us working together, each of us playing our role in the fight against COVID-19. End quote. Just under 3 weeks ago, the ministry ramped up testing with the aim of processing at least 300 samples daily. The previous amount of 30 test samples per day was insufficient to correctly determine the actual COVID-19 situation in the country in terms of the number of positive cases. The release noted that the National Public Health Reference Laboratory is currently operating 3 shifts, which allows for more test samples to be processed, and by month end, more PCR machines will be added. For InfoHub, I am Kellon Rover.
The Georgetown Public Hospital Corporation, under the guidance of the recently appointed Minister of Health, Dr. Frank Anthony, is ramping up efforts aimed at tackling the COVID-19 pandemic. Director of Medical and Professional Services at the institution, Dr. Fawcett Jeffrey, outlined the hospital's integral role in the fight against the virus.
Dr. Jeffrey and his team have been directly involved with the management of the COVID-19 patients since the hospital is a Level 3 institution in Guyana.
That the Georgetown Hospital is the end point of medical care in Guyana. So whatever we do or whatever we advise is usually going to be the advice that is taken, because we are the institution that all the other regional institutions and other institutions would tend to emulate. So as the medical director of the hospital, we know that we have a major responsibility to not only the Georgetown population, but to the nation as a whole.
Dr. Jeffrey noted that the Georgetown Public Hospital Corporation has demonstrated major strides in its response to the COVID-19 pandemic.
Our intervention relative to COVID since the pandemic started and since we had our first case was to assist in the training and education of doctors, nurses, and all healthcare workers, not only at the Georgetown Hospital, but in the entire country. So we had trainers go and train persons to become trainers so that at least there would be a uniform response from a medical point of view in the entire country.
Ensuring the safety of staff, patients, and the nation as a whole, Dr. Jeffrey shared how the Georgetown Public Hospital Corporation has mobilized its resources since the beginning of the pandemic.
So we started by setting up checkpoints, which we call screening points, in all the entrances of the institution. And then we had zones that are called triage areas. And these triage areas are where, if you're identified as possibly having symptoms that are suspect of COVID, you could actually be sent to a triage area where you will get a more detailed physical examination and interrogation using a checklist. And if you were deemed possible COVID, then you would actually be sent to get a swab. You would be sent to isolate or quarantine, or based on our findings, that's what we were doing.
The hospital's COVID-19 task force, under the guidance of the new Minister of Health, Honorable Dr. Frank Anthony, continues to respond to the nation's needs in battling the novel coronavirus.
We are happy to say that the policies and protocols that were written at the Georgetown Hospital are actually going to be some of the policies and protocols that will be used nationally to assist with the fight against COVID. So some institutions can take our policies and protocols and modify them according to their needs and use them.
The Georgetown Public Hospital Corporation is also working with the new People's Progressive Party Civic Administration to ensure the smooth transition of patients to the Center for Disease Prevention and Control. Dr. Jeffrey also shared his advice to the public.
COVID exists and COVID is real. And we see what happens to patients who are COVID positive and are severely ill. Our death rate is also going up. And my advice to the public is there are rules, there are advisories that are going out to the public that you should wear a face mask, you should socially distance, you should try to stay at least 6 feet apart where possible. You should only go to places that are safe. Do not, I've noticed persons on the streets at night, at a corner, they're drinking alcohol, they are smoking, they are having a small party, and that is dangerous because amongst you, you can have an asymptomatic person, no symptoms, no cough, no fever, but yet while you're in that group, you could be contaminated, you could become infected, and then you could be the unfortunate person who ends up in our COVID ICU and probably do not make it.
For InfoHub, Gavin Lewis.
The use of convalescent plasma therapy has been explored for years and has now become essential in treating severely ill COVID-19 patients. Cardiologist at the Georgetown Public Hospital Corporation, Dr. Mahendra Karpen, disclosed that at the end of July, 4 COVID-19 patients were treated with convalescent plasma and have fully recovered. Dr. Karpen noted that this is one of the many interventions the GPHC is proud of, since it is one of the pioneering institutions for such treatments. Blood from persons who would have recovered from severe deadly illnesses is called convalescent plasma. The blood is processed in the normal sterile manner and is given to persons who are sicker and require more than antibiotics or other medical management strategies. The 4 persons who have recovered were among those who volunteered to be on the clinical trial for this treatment. The possibility for trials to be rolled out was explored after the onset of COVID-19 in Guyana. More news after this short break. Stay with us. Welcome back. Cuba's ambassador to Guyana, Narciso Socorro, paid a courtesy call on the Minister of Education, Honorable Priya Manikchand, today. The parties discussed areas of mutual interest and how partnerships can be established in various areas to benefit the people of both countries. The ambassador was accompanied by his personal assistant, Ms. Myra Perez, and also participating in the discussions was Mr. Keon Chung, coordinator for Regional Special Education Needs and the Disability Diagnostic and Treatment Center at Turkine. The Disability Diagnostic and Treatment Center is an example of collaboration between Guyana and Cuba, where the technical training of staff at the facility was facilitated by the government of Cuba. The Ministry of Education looks forward to continued partnership for the development of the education sector in Guyana. Minister within the Ministry of Housing and Water, Honorable Susan Rodriguez, announced that some services such as residential house lot payments, which falls under the purview of the Central Housing and Planning Authority, will be resumed.
I am pleased to announce that under strict COVID-19 safety measure guidelines, some of our services under CH&PA have resumed. These services include rangers patrol, residential house lot payment, surveying of lots with one person allowed on that visit, and visits for planning permission.
Minister Rodriguez assured that as the Guyana Water Incorporated continues its services, no customer will be subjected to disconnection until further notice.
On the GWI, all services have been resumed, and we remain steadfast to our commitment not to carry out any disconnections during this time.
The minister reminded Guyanese that the promises made by the People's Progressive Party civic government of improved quality of life, access to affordable housing, and the delivery of potable water will be realized. She explained that the administration will work diligently to resolve all issues.
We have inherited a backlog of land applications, lands that lack basic infrastructure, and in some cases which are not even accessible, and an allocation system which is in need of thorough review. Nevertheless, we are committed to our mandate and are working assiduously to address these challenges and will resume land allocation as soon as practicable.
The Ministry of Housing and Water has put in place additional measures to keep both staff and customers safe. She encouraged Guyanese to follow all the safety guidelines.
I urge you to be responsible, stay safe, protect your loved ones, and adhere to safety guidelines as together we endeavor to stop the spread of COVID-19.
For InfoHub, Gavin Lewis.
Remember to do your part to ensure you do not put yourself at risk during this time. If you have a cough, fever, and difficulty breathing, seek medical care early, but call the hotline first. That's all for today. Connect with us on all our social media platforms, including Facebook, YouTube, and Instagram, and visit our website, dpi.gov.gy, as we bring you the latest and important news on what the government is doing to ensure the continued development of our country. Your Bridge reports are up next. Have a safe and enjoyable weekend. Goodbye.